I never would have dreamed it. Look, my kid gets married August 1st, okay? Guess what? Guess what? I'm gonna dance at my kid's wedding this year. When prior to this, I wasn't even sure if I was gonna be able to be there for more than a couple hours. So, I'm serious. I've had multiple accidents. I knew at some point that my life was the injuries were gonna take effect. I was very active in deep woods camping, fishing, kayaking. I coached football for 10 years. Even with the injuries, nothing stopped me. About 5 years ago, it took effect hardcore. Couldn't do anything anymore, except work. Life changed bad. It was horrible. Didn't want to do anything anymore. My wife. I was at the end of my rope because I didn't want to live like that anymore. One morning I got up, it was a Sunday morning, and I was just Googling stuff and alternative treatments to lumbar fusions. One of them caught my eye, the top system. I emailed them. The gentleman emailed me back with the parameters for this FDA clinical trial. 65% chance you would get it, and 35% you would not. 28 surgeons in the United States could perform this surgery, and we had one of them right here in Coeur d'Alene, Idaho. And if there was an opportunity, even the slightest opportunity for me to get a device in my back that was going to preserve motion, yeah, not even a choice, it's yeah, roll the dice.
The current standard of care for spondylolisthesis is fusion surgery, and the problem with fusion surgery is that we rob patients of their ability to have normal spinal motion. And so the reason that the TOPS technology is, in my mind, preferable in the right patient is that we retain their normal motion of the spine while providing that increased stability that they've lost. I met David first after he had reached out to us expressing interest in the study. In his particular instance, with the instability of the spine, I knew that he would be a good candidate for a motion preservation procedure, and in this case, the TOPS procedure.
The confidence in which I saw in his mind, in his heart, in his eyes. Done. In a 5-minute meeting, I knew exactly who that man was, and regardless if I was going to be accepted into the TOPS program or not, I knew that at some point he was going to do surgery on me. And the fact that he looked at me and said, "Let's do this." Without them, this wouldn't happen. 15 days after surgery, I was walking almost 2 miles. I can't explain it. I mean, I can feel my legs before the surgery. The neuropathy is in the bottoms of my feet. I haven't felt the bottoms of my feet for 3 years.
The exciting thing about watching his recovery is that his ability to return to that level of function has been very quick. Thankfully, it's one of these things that we get to see quite frequently, and it's always exciting when the patient is willing to share the increased function that they're able to participate in as a result of any of these procedures. What we're excited to see over time is David interacting with his family, David interacting at work, and doing the things that he's been struggling to return to.
I hope I get to see and be around these people, or at least do what I can for them like they did for me for the rest of my life. I drive by here every Thursday, man, and I look at this place every Thursday and I just go, my life is back. I'm looking forward to everything again. And then some. Whatever I want. I'm not going to be limited.